Hello, everybody. Thank you so much for joining us today. We are excited to bring you a presentation about self-compassion. So we've entitled this Me, Myself, and I because we really believe that in order to feel your best self, we want you to take care of yourself. So we're going to start off with some introductions. My name is Desirai Browning. I am one of the counselors here at the Mesa ATSU campus. I've been here a little over 6 months now, but it has been a great time and I've truly loved my experience here. And I am joined today by the amazing.
Hello, everybody. My name is Karen Taylor. I am the second therapist here at the Mesa ATSU campus, and I have just reached my 3 months. So I'm super excited to be here and excited to be a participant on this workshop, as well as one of the therapists here hoping to help change lives and help you guys be a success as you go through this journey of medical school.
All right, thank you, Karen. So we're going to go ahead and get started on our topic for you today. Once again, thank you for taking the time to join us. We have a couple of different things that we are going to be going over. So we want to make sure that we go over the positive impacts of self-compassion and the vulnerability that also happens with this process. We understand sometimes when we ask you to be self-compassionate, we're not really sure what that means. So we want to go ahead and explain what that means to you today so that way you can practice it. And so that way you can also take away some tools to manage some of these critical thoughts you might be having about yourself. And I promise we'll get a lot more into that soon. And we're also going to be able to practice that vulnerability as well. So one of the things that we want to start off with is some terms to know. We want to start with that self-criticism versus shame. Self-criticism refers to the thoughts, while shame really refers to the feelings that those thoughts generate. So we might have a thought like automatically, but that's just the thought right there. That feeling that follows up afterwards, it could be shame, it could be guilt, it could be a lot of other different feelings. And then we get into guilt versus shame. Guilt is saying I did something bad or I made a mistake, while shame is saying I am bad or I am a mistake. So really taking on those qualities and really personifying them. And then we also have growth mindset versus fixed mindset. That growth mindset involves believing that you can grow and change, seeing that you can grow into something and that your qualities have the ability to actually change, that you're not just fixed and static, which is what that fixed mindset is about. It involves feelings like your life skills or abilities are fixed and static and that they're not really able to change or you don't have control over them.
So let's talk about self-criticism in light of self-compassion. So what exactly is self-compassion? I would describe self-compassion as just self-kindness, learning to be kind to yourself, because too often when things happen, we become very critical and we forget the humanitarian part of ourselves, that as humans, things happen. No one was born believing that everything in life was going to be 100% perfect. And when things aren't perfect, then we tend to take blame for those things and criticize ourselves. And that is not being kind to ourselves. So when you think about it, what are some things that you are critical about when things don't go right for you, or you feel as though life has thrown you a curve and you somehow feel responsible for it? What are some of the things that you think about that are so critical? I know for me, sometimes I can be a perfectionist. And I can have these negative thoughts about myself because it didn't go the way I wanted, or I felt like, oh, I should have done it differently. So those are just an example for myself. I don't know if Des has an example she might want to give. But if not, as you can see, mine just popped up, perfectionism. Des, would you like to share one before we go through the list?
Yeah, one of my self-criticism things is I definitely can lean towards the perfectionism side, but also some self-criticism in terms of the whole, am I good enough? Is this going to work out? Do I have the skills that I need to accomplish what I'm trying to do? Which often leads me into this process of having so many choices and not knowing if I'm capable that sometimes I just freeze because I'm not sure what the next step is that I'm supposed to take and if it's the right step I'm supposed to take. So those are usually some of the self-criticism thoughts I have, but some of the tools that we'll go over today have definitely helped me to curb a lot of those thoughts as well.
Well, as you look at the list, some of you may have selected some of the items on here. As we stated before, perfectionism, both of us mentioned that. But when you're self-critical, your goals are decreased. Your attainment of those goals are decreased. Your anxiety and depression is increased. It leads to physical burnout. Your self-esteem is low. Your motivation is lacking. There's feelings of guilt and, unfortunately, feelings of worthlessness. So those are things that we are going to talk about, and why self-compassion is important. Because self-compassion, there is an antidote, and that is what exactly it is, self-compassion. So in light of that, think about some of the antidotes that you can use to combat self-criticism, so that you learn to be more kind to yourself. So I just want to take a moment just to kind of think about that. And then, as you can see, it popped up. One of the antidotes to self-compassion is increased emotional well-being. It's enhanced. Your mindset becomes more positive in this state of mind. You have fewer negative emotions, and your reactions when goal progress is disrupted. Decreased procrastination and avoidance-oriented strategies. So essentially, the antidote is to find and understand that as a human, things are not going to go right, as I mentioned before. And instead of criticizing yourself, what are some things that you have done that have helped you get to this point? I know a lot of medical students have talked about imposter syndrome, and I shouldn't be here. Well, if you've done all the hard work, why shouldn't you be here? So being able to celebrate your wins, finding things within you that help you understand that life is a process. Humanity happens. We are humans. Things are going to happen in this world that we can't control. But what we can absolutely control is how we respond to those things. And we want to respond in kind to ourselves. So self-compassion can be learned. And that's what we would like for you all to understand, and what we're trying to get across to you today. And some of those methods involve cognitive distortions and understanding how our thought processes dictate our behaviors, but additionally, being mindful, practicing mindfulness-based interventions. So that includes meditation, mindful movement, walking, yoga, body scanning. But one of the things that I like to mention about mindfulness is just being aware of your thinking, being aware and sitting in that moment, because too often when we're uncomfortable, we will isolate ourselves, or we will avoid the emotion or the feeling that comes with whatever we're dealing with. And we don't want to do that, because the most important thing that I want you to remember, or should I say we want you to remember, is what you don't reveal, you will not heal from. So that is very important to understand. In order to heal, you need to be able to acknowledge and feel and reveal those emotions. So that's one of the mindfulness-based interventions that are very important when it comes to our cognitive thinking and how we process things that happen. And then externalizing your inner critic, developing thought awareness. Again, sitting with that, asking yourself, taking a moment to pause, taking a moment to reflect, taking a moment to think before you actually react. Examining the evidence or the facts. Is what I'm feeling, are there facts to support this emotion and feeling that I'm feeling at this moment that leads to me believing that I'm a certain way, or I'm not capable of any of those self-critical thoughts? And then reframing your critical thoughts with more positive and accurate statements. That is very crucial, because one thing is absolutely certain. There's not one thing that you will do in this life that is not a thought first. And too often we are reactive, and we don't take time to focus on what we're thinking and align facts and evidence to support it before we react.
So another thing that we've mentioned so far has been this fixed versus this growth mindset. So you can see some of the examples that pop up here, and as you're sort of going through them, and as I'm discussing them as well, ask yourself, what mindset do I tend to typically lean into? How can I change some of these phrases that I've been telling myself, or these things that I've been thinking, to work to be more towards a growth mindset? So some of these examples of that fixed mindset include failure is the limit of my abilities, or I'm either good at it or I'm not. But what about all those gray areas too? This is where we talk about that perfectionism, where we don't always have to be perfect. We can learn to do anything that we want to do, and that these challenges are going to really help us to grow. Some of these phrases are also feedback and criticism are personal. So if somebody gives you feedback in one of your lectures or classes or anything, we might take that as a personal offense, whereas it might be your professor saying, hey, this feedback is constructive, I'm telling you this so that way you can continue to grow and continue to be the best physician or whatever background that you are going to be. So being able to look at some of these fixed mindset things, and if some of these are resonating with you, see what that growth mindset looks like. See how we can shift that perspective and that inner dialogue that we're having with ourselves or even with our peers as well. We know sometimes that your peers can also have a big impact on how you view yourself. And so being able to practice these self-compassion moments and these mindsets can really be helpful for you as students. So let's go ahead and actually put some of this self-compassion into practice. We wanted to not just tell you about all these things, but also make sure that we give you as many tools as possible. So that way you have some really good tangible things that you're able to take away from this. So one of the practices that we're going to talk about today is these components of self-compassion and the physical exercise that goes with it. So this is by Dr. Kristen Neff. She's one of the psychologists. This is her responding to self-criticism, and there's an activity associated with this. So in this moment right now, think of something that brings up some stress for you. I promise, I know I'm bringing up something, but we're going to work through it. So we're going to bring up this stressful thing that we're going through right now. We're going to feel it. Can you feel your shoulders tensing? Can you feel like maybe your neck is starting to hurt, or that pit that you get in the pit of your stomach? So judge up this emotion, just feeling whatever is going on at that moment, and practice this moment of mindfulness. Practice saying, this is a moment of suffering. Put it out there. Sometimes by even acknowledging that we're struggling in this moment, that's a really good step into also that healing process as well, to not downplaying the emotions that you're feeling. That's part of being self-compassionate as well, being honest with yourself and feeling what you need to feel. Like Karen said earlier, making sure that you're feeling things in order to heal. Being able to tell yourself in this moment too, as we're having this moment, realizing that everybody also experiences difficulties. Maybe you tell yourself in this moment, ouch, this hurts. I don't like this. This wasn't a good feeling for me. And so as this is coming up for you and we're just acknowledging that we're here in this moment, that's that first step. That second step, we're now going to go ahead and place a hand over your heart and acknowledge that suffering is a part of life, or difficulties are part of life to get to, either a good thing or to move forward and to be able to grow from these instances. Realizing that what we're going through is commonly experienced by all human beings in some capacity. And as our hand is over our heart right now, this is where we now take this moment to be kind to yourself. Ask yourself, what do I need right now? Do I need forgiveness? Do I need patience? Do I need understanding? Do I need validation? Or do I just need a little bit of love right now? Responding with kindness and understanding towards ourselves when we're suffering or feeling inadequate, those are powerful emotions to start rewriting some of those self-critical thoughts that we have about ourselves. To really sit here in this moment with our hand over our heart and say, I am going to be okay, or I forgive myself, or I am not my past mistakes. Those are statements that we're able to just take a moment, acknowledge this hurt feeling that we're having right now, recognize we're not alone in this, and we don't have to be alone in this, and give ourselves what we're looking for. Hopefully this is an exercise that helped to decrease some of this a little bit. Maybe the shoulders are a little less tense, that pit in the stomach is a little bit smaller, or we just finally got some of that emotional relief that we've also been seeking as well. So this is just one tool. If this tool also maybe was not your favorite tool or it didn't work as well, that doesn't mean that there are no tools. It just means that there are other tools that you're able to utilize as well. And we want to make sure that we're able to give you those as well. So with this wrap up, this is where we're going to get into some of those other tools. So some of the other tools that you're able to exercise is going to be the self-compassion break, taking just 5 minutes. Now you can take a picture of the screen as you're watching this video and then type in whatever you need to type in. So then that way you're able to pull up some of these exercises. You can also try this loving kindness meditation. It's about 20 minutes long, but it's an opportunity to just sit, be still, work through that process. There's also some videos that you're able to watch and even self-compassion for caregivers. Knowing what school you all go to and knowing that you're all excellent folks with incredible skills for empathy and caregiving, sometimes we take on so much that we forget to just take care of ourselves in that process. So this is something that directly addresses what that common occurrence is. We also have a self-compassion journal that you're able to utilize. If maybe books or video or things are not your jam, maybe you just want to write it out. Get out what feelings you're feeling. You can scribble, you can do all sorts of things with the paper. Journaling doesn't have to look pretty. It's just a way for you to be able to get out what you want to in that moment. There's a compassionate letter to self. You can write things where maybe a week from now, you might know that you've got a lot of tests coming up, or it's just a hard week. This is a letter that you can pull up for yourself and read and be like, wow, past self was really looking out for me, and I really appreciate that. There's also a book by Brene Brown, The Gifts of Imperfection and the Power of Vulnerability. And Kristen Neff's The Proven Power of these things as well. And there's also a self-compassion workbook, things that you're able to sort of work through, different exercises, lots of different things that might come up for you. Like I said earlier, just because one exercise doesn't work, doesn't mean that no exercises will work. There's a lot of good practice in being able to figure out what your best medium is. And other great resources as well include any of your ATSU resources like Timely Care, Me and Caring, if you are in certain states, especially if you are in the Mesa area. I know we also have in-person counselors at the Missouri campus, and there's also counseling available at the California campus. So we want to make sure that you folks are feeling as supported as possible in your self-compassion journey. If you have any questions or anything, definitely reach out. But I also want to make sure Karen's able to say what she wants to say before we officially wrap up.
Yes, I wanted to just leave you all with this reminder. As medical professionals, you are going to be entrusted with providing quality care to those that you serve. And the reason why, again, we wanted to do this workshop was to help you understand that self-compassion is really defined as self-kindness. And you can never pour into anyone else what you don't embody. So it's very important for you to be kind to yourself so that you can do what you need to do to serve those that you will be serving.
Thank you, Karen. That's an excellent reminder for our students. So students, if you do have any questions, if you have any concerns about things, please reach out to the resources that we have listed for you and try some of those exercises that we talked about. See if that helps relieve some of the tension that we're feeling and see if it increases some of those self-compassionate and self-loving thoughts that we have. We thank you so much for joining us today. Thank you for taking the time to watch this video, and we hope that you folks all have an amazing day.
Bye-bye.
Bye.